scary word, but these are natural changes. These are normal changes in the virus. So changes and mutations we use interchangeably. I use changes more often when I speak publicly, but that's the same thing as mutations. The one thing that I think is important that you know about and that the world knows about is that WHO is working with virologists all over the world, people that have incredible experiences with not only viruses and high-threat pathogens, but coronaviruses in particular, and those who study these full genome sequences and study what these changes mean. Because it's important that, like I said, that they change naturally, but are these changes important? Do these changes mean that the virus is behaving differently? Do these changes mean that diagnostics may not work or we may need a new type of a vaccine? And so far, the virus seems relatively stable in the sense that the diagnostics work, the vaccines that are in development, the therapeutics that are in development are still applicable for this virus that is circulating, and that's important. But we have a system in place to help us and to advise us on which of these mutations are important, and then how do we further study them in the lab to look at the differences that those changes may mean. But so far, it's around 84,000 full genome sequences that have been made available, and I would like to just quickly continue to stress the importance for these viruses to be shared, to be sequenced, and to be shared, and to thank all of you who are out there who are continuing to do that.
Thank you very much, Dr. Van Kerkhove. For the next question, we will go to Spain, to the Spanish newswire EFE. It goes to Isabel. Isabel, can you kindly unmute yourself and ask your question?
Yes, thank you, Margaret. Good afternoon. Some new studies say that children may transmit the virus up to 3 weeks after being infected themselves. And even when they have been totally asymptomatic. And the information that you have corroborates this information, and this is proper to children, or this is something that happens also in adults?
That's a question for Dr. Van Kerkhove, I think.
So I will begin. Thank you for this question. So when we look at testing of individuals, we carry out what are called molecular tests or PCR tests. And this indicates evidence of particles of the virus, parts of the virus in an individual. Having somebody test PCR positive doesn't necessarily mean that they are shedding live virus, that they can actually transmit a live virus to someone else, that they're infectious to somebody else. What we understand from the data coming from labs is that people can be PCR positive, meaning that we can capture fragments of the virus for many weeks, in fact. And it depends on how severe a person is. It depends on how severe their disease is, because you can shed virus, you can have a PCR positivity for many, many weeks. But that doesn't actually mean that you can transmit the virus for that long. What we understand about infectiousness, of when somebody can transmit to others, that comes from trying to isolate the virus or grow the virus from a sample collected from an individual. What we understand, there are a few of these studies that have, what we understand from those results, and these are still preliminary, what we understand is that people we can isolate live virus, which means they can transmit to others just before. So it appears people are most infectious at or around the time that they develop symptoms and for the first 5, 6, 7, 8 days of illness. This can be different for individuals who have severe disease. And there's one example of a study that is, I don't know if it's actually published or it's still in preprint, of severe patients who are hospitalized and therefore isolated that can shed live virus for up to 3 weeks. So it depends on the severity of their illness. But just because somebody is PCR positive for many, many weeks doesn't mean they can actually infect people for that long. So this is what's important. Why we keep saying that it's really important that we carry out active case finding and that we isolate individuals for a set period of time, and we have definitions of how long people should be isolated based on the data that I just provided to you. It's also important that we carry out the contact tracing, and we find those contacts and we quarantine those contacts. This is what breaks chains of transmission.
Thank you very much, Dr. Van Kerkhove. Looks like there's no further interventions in the room. The next question will go to Marianne Benitez from the Hong Kong Standard. Marianne, can you unmute yourself and go ahead with your question?
Hi, can you hear me?
Very well, Marianne, go ahead.
Okay. Hi, thank you for taking my question, Dr. Harris, my friend from Hong Kong. Anyway, my question is, what's the WHO stance or guidance on emergency authorization of vaccine before phase 3 trials is complete, as done in China and Russia, and now possibly the US, after its FDA chief, Dr. Han, said it's possible to approve emergency authorization of vaccine for use in selected settings like he did with convalescent plasma. Thank you.
I think that's a question for Dr. Swaminathan. Dr. Swaminathan, are you online still?
Yes, I'm here, Margaret. I can start and Mike might want to supplement because of the past experience that he's had in other emergencies, including Ebola. The emergency use authorization or licensing is something that has to be done with a great deal of seriousness and reflection. It's not something that you do very lightly. Of course, it's every country's national regulatory authority has the authority within their own territories to make these decisions. As far as WHO is concerned, we have on our website a guidance document which lays out step by step what the approach would be. Our preferred approach, of course, is to have complete data set that could be used for pre-qualification of vaccines, and that would then allow large-scale procurement by global bodies and distribution to countries. That's the preferred route. For the EUL, it would depend really on the data that the manufacturer provides to WHO, and it's going to be based on efficacy and safety data, as I described earlier, and it would be considered on a case-by-case basis. Over.
Thank you, Dr. Swaminathan. Dr. Ryan, do you have something to add?
No, I agree very much with Sumia. We have an experience in using investigational use of vaccines in the field. We've had the most recent experience with the Ebola vaccine in the field, and it proved very successful. But in order to bring that vaccine to the field, we had to do that under an investigational use approach, which meant collecting huge amounts of data, having adverse event surveillance in place. It involved a lot of monitoring, a lot of safety follow-up. So the more you move to use a drug or a vaccine from an emergency use point of view, it still does not take away the need to collect important information. The difficulty and the challenge with the vaccine is at the moment we're moving from vaccinating tens or hundreds of people to now vaccinating thousands of people. We need to get the safety and efficacy signals from those studies. Because if you move too quickly to vaccinating millions or hundreds of millions or billions of people, you may miss certain adverse events that you won't pick up with smaller numbers, and you need to maintain monitoring. But as Sumi has said, each country has a sovereign right to define its policy for vaccination or any other therapeutic intervention in its population. But it must be guided by the highest possible ethical standards, the highest possible scientific standards, and where countries do move forward with any form of emergency use authorization, it should be linked to very intensive and increased monitoring of the implementation of that product, and with a very clear view that if any safety signal was picked up, that there would be an immediate change to the policy. So there are very strict guidelines around the emergency use and how it's done. And organizations in Europe, the FDA in the USA, the EMA in Europe, we have similar regulatory authorities in Africa and India and other places. So I think it is really important that countries, governments are guided by their national regulatory authorities and maintain the highest possible standards so that we maintain a position of looking for safety and efficacy before using these new products at population scale.
And Dr. Edward Kelly will add something as well.
Just to add briefly to that, I think one important point for our colleague from Hong Kong also beyond the licensure is the fact that however these vaccines move through that important process to look at efficacy and safety, they then need to get out into health systems globally. It's been over 50 years we've had the measles vaccine roughly, and we are still struggling to make sure that every child gets a measles vaccine in countries around the world. And this is part of what Bruce referred to earlier. That's the key piece of the ACT Accelerator of all these partners working together, not just to come up with the tools, but also make sure that they get implemented in countries.
Thank you very much, Dr. Kelly, Dr. Ryan, and Dr. Swaminathan. The next question goes to Nina Larson from Agence France Presse. Nina, can you please unmute yourself and ask your question?
Yes, hi. Thank you for taking my question. I saw that David Nabarro, one of WHO's special envoys on COVID-19, hailed Sweden's approach to the coronavirus crisis in an interview with New Zealand radio, seemingly avoiding the blunt instrument of lockdowns. But a graphic on WHO's website shows that Sweden's death rate at nearly 58 per 100,000 is among the highest in the world, and certainly much higher than in neighboring countries with similar cultures and populations. So my question is, does WHO indeed think that Sweden is a good example of how to handle the pandemic? And do you agree with the country's public health agency chief who indicated it was now controlling the outbreak and could probably avoid a second wave that seems to be affecting the rest of Europe? Thank you.
Dr. Ryan, would you like to answer that? Yes.
I can begin, and certainly from the perspective of from a Swedish perspective, I think even in Sweden and Anders Tegnell and the team there have done a good job, and they by themselves have said that even despite the measures they put in place, the issue for them was in not having had adequate protection for long-term care facilities, and they suffered very high death rates because of very high death rates amongst older people, particularly those in facilities. They also had issues of transmission amongst ethnic minorities as well. So nobody has come through this pandemic with a perfect strategy. Everyone is learning about the virus. The approach in Sweden of having, and again, there's a misunderstanding that Sweden has not implemented control measures. Sweden has implemented quite strong control measures for COVID. But what it has done in the main is try to rely on individuals and communities to comply with the advice of government, and it has tried to avoid imposing mandatory lockdowns, mandatory separation of individuals. And that's based on a very high level of trust historically between government in Sweden and its own population. And that is the way in which Swedish people and the Swedish government interact. That is the social contract in Sweden. But it is wrong to suggest that Sweden has had an altogether different approach to the rest of Europe. In fact, it has had an approach of light touch regulation of the process. In that process, they have suffered with high death rates in long-term care facilities, and by their own admission have said that in itself was an error in not providing adequate support or care or protection in those situations. And I think that's the case in many, many countries. We're taken aback and surprised by the high rates of death and the high rates of infection in long-term care facilities amongst older people and people with underlying conditions. So from that perspective, and we all have to learn how to live with this virus. I've said at previous press conferences that there is a point at which we, in learning to live with the virus, we try and find a way to keep our societies as open as possible, while at the same time breaking chains of transmission and controlling the infection. Now, how do we find a way to control the infection, suppress the infection, break chains of transmission, and at the same time open up our societies? And these are almost impossible concepts to reconcile. How can we calibrate our response to do the least damage to our society but the most damage to the virus? And can we sustain those behaviours? Can we sustain that process for long enough through which time as we can have a vaccine? There are no correct answers to this. The context of each country is entirely different. The social contract is entirely different. The relationship between government and populations is entirely different. And each government has to find its way. with its population to control the disease. And there are lessons to learn from every country and its approach. No country has done it perfectly. All countries have made mistakes, but all countries have done some things correctly. And we should look at Sweden. We should look at the model. We should look at their approach to see what elements of sustainability, what elements and ways they have learned to live with the virus, and learn from what has been done well and what has been not done not so well in all countries, including Sweden.
Thank you, Dr. Ryan. Okay. No further interventions from the room. The next question goes to Hilary from Business Insider. Hilary, please unmute yourself and ask your question.
Hi, yeah, thanks for taking my question. I just wanted to ask Dr. Tedros a follow-up from the opening remarks today. You said that countries can find, quote, creative ways to hold gatherings if the virus transmission is low enough. And I was hoping you could be a little more specific on, what are some of those creative strategies and what do those look like in practice?
So thank you for the question. I'll begin. So yes, I think one of the big messages we want to get out is that in countries that are able to control this virus, and this virus is controllable, it takes a lot of hard work, there are ways that people can remain to find ways to be social again while still being physically distant from one another. And this involves mass gatherings, and we have outlined guidance on how and when mass gatherings can take place and whether they should be postponed or canceled, or in other situations whether they can take place safely, all the way through sporting events, through individual barbecues that happen and birthday parties that happen at people's homes. And I think the way we've seen some creative use of bringing people together socially while keeping them physically distanced, whether these are barbecues that take place and you have, different situations in backyards where people are quite spaced. I've seen some very creative nightclub situations where individuals have to, you'll only have 1 or 2 people per car, and no one can leave their car, and there's a DJ playing and they have music playing. Again, we are social creatures. We miss our friends, we miss our families, and there's different ways that we can find to get that creative outlet. But we do need to take individual responsibility. Those that are hosting events like this have a responsibility to have them done safely, and in some situations they may need to be canceled, they may need to be postponed, and we do realize that that is difficult and that's a sacrifice that we have to make. But as individuals, there's decisions we need to make about, do I participate in this? You've heard us say before, if it doesn't feel safe, then it probably isn't. But you have a responsibility to try to minimize your exposure. And in many countries where they are controlling transmission, social events can start to take place safely. So this has to do with limiting numbers, it has to do with keeping people separated, and making sure that when you do bring people together in a physical space that they stay at least 1 meter apart. But one last thing just to mention young people here, because unfortunately we are seeing some clustering events, some amplification events that are taking place in nightclubs and in different types of entertainment industries. But there's ways that perhaps that could be done differently and things could be done outside. And so work with us, and that creativity and that ingenuity, and that is something that we need to think about how our new normal goes forward.
Thank you, Dr. Van Kerkhoff. We're coming up to the hour, so I think we've only got time for 1 or 2 more questions. The next question goes to Sarah Wheaton from Politico. Sarah, please unmute yourself and ask your question.
Yes, thank you. A question about COVAX. The European Commission announcement that you referred to today, they've said they're still working out they won't answer questions basically about whether they'll actually be procuring vaccines through COVAX, although they have said that they will join the effort. So does it make a difference for the success of COVAX if the European Commission and European countries actually participate or actually procure through you? Thank you very much.
This is once for Dr. Aylward.
Thank you, Sarah, and some you may want to add to this. There's different ways in participating, joining forces with, and working with the COVAX facility. Remember, the goal here is to make sure that all countries get some vaccine at the same time we roll it out together, rather than some countries get all of the vaccine. Because the goal is to reduce the risk of severe disease globally as rapidly as possible. And so we know who's at highest risk of severe disease. Those proportions are different a little bit around the world, of course. We know the people who care for those people who need to be protected as well. So the goal is to roll it out in a coordinated way. Now, everybody who has bought options on vaccines or vaccines around the world are going to affect the speed with which products get rolled out to countries around the world. So the goal in joining forces between COVAX and the EU, there's many different ways that can look. I'm surprised they're not answering their phones, because it's a great story. Their commitment is to make sure that we can work together to reduce the risk around the world as rapidly as possible. Key to saving lives, key to taking severe disease down, key to taking pressure out the healthcare systems, and ultimately to getting our societies and our economies open again. And indeed, every aspect of the COVAX facility is being worked out in real time. So not surprised at all that the EU wanted to make a very strong statement of a commitment to this joint solution, but also recognizing that there's going to be unanswered questions we're going to have to work out as we go forward. As you've seen over the last couple of weeks, we've had to introduce new design elements to the COVAX facility. That meant more countries could participate, that it's stronger, it's better, and we'll continue to do so as we go forward. So procuring through the same mechanism, that might be ideal, but that's not necessary to be able to work together and achieve the goals of the facility. So the big thing now is how we work together.
Thank you, Dr. Aylward. Oh, Dr. Kelly would like to add something. And the DG.
Just quickly, I'll say that to add to Bruce's point, whether procurement equals success for the COVAX, it's just to add to the piece that, of course, this is within and connected to the overall ACT Accelerator work that's there. And as someone who's worked at, WHO for about 13 years and nearly a decade before that with the U.S. government, the current collaboration between the global institutions working in public health is quite unprecedented. And I think that in and of itself is going to be one of the big successes in terms of how this has an impact for the vaccine, but also for the diagnostics, the therapeutics, and the other pillars of the ACT Accelerator.
Thank you, Dr. Kelly. Dr. Sumia, do you want to add anything, or is that enough? Okay, I will go to the last question. Oh, no more. Okay.
I don't have it.
So the last question will go to Germany, to ARD Radio, Karl Mora. Karl, can you unmute yourself and ask your question?
Yeah, thank you very much for taking my question. Can you hear me?
Very well. Please go ahead.
I have not a medical question, but I think it's an important question. People in Germany and other countries demonstrate, protest against the protective measures, and they ignore the protective measures while this protest just happened in Berlin on Saturday. What is your advice? How should one discuss with these people? How should governments, authorities deal with such demonstrations?
Maybe I can start with that.
Please do.
Start by Ria's recommend. I think it's in dealing in epidemics for a quarter of a century now. Bruce and Ria and others will have the same view, and I believe epidemics and emergencies, create strong emotions, and acceptance of measures is always very, very tough. And it's really important that governments don't overreact to people protesting against measures. It has happened since time immemorial. The real important thing to do is enter into a dialogue with groups that feel that they're protesting against measures. We want to live in free societies where protest is facilitated, but we also want those protests to be done safely. We don't want them to increase the risk of disease transmission. But it is really important that the process of reaching that compromise and reaching that safety is done through a process of dialogue. And we try to build relationships across society, not divide society, not to create division, not to create more division. When people protest, it's because they're protesting against something they perceive to be unfair or unjustified. It's really important then we enter into a dialogue with people to explain why these measures are being put in place. And you may not convince everybody. It's the same thing when it comes to vaccination. You may not convince everyone to be vaccinated, but it's really important that we're not imposing will upon people. But at the same time, we're cognizant of the fact that these protests, and Maria spoke to it earlier, gatherings can occur and they can be made to be safe. And we should not be shutting down protests. We should not be shutting down the right to dissent. But we should be trying to make that as safe as possible. And the best way to do that is to create the opportunity for dialogue. And I've done that myself so many times in the field with communities. It takes time, it takes listening, it takes people being reasonable. And what other way is there for our society to progress and evolve unless we're willing to listen to each other and understand not everyone has the same opinion, and try to find a way as a society to move forward together and not polarize things constantly into opposing camps and opposing forces. This is not healthy for our society. So I would advise governments to try and find a way to initiate and sustain dialogue with all sections of society and listen. One thing that Dr. Tedros has taught us, and certainly taught me, is that you have to listen. You have to open your ears, open your heart, and listen to what people are saying. Because sometimes people are saying things that are important and they need to be listened to. But we try and must try to make such protests as safe as possible. Dr. Tedros may wish to comment, or any of the other people there.
Thank you, Dr. Ryan. It is the last question. I was going to say I will let Dr. Tedros finish. Final words.
Yeah, thank you. Maybe I will use the opportunity to add, that's why I was asking you the floor, but I will just be very brief. One, on the amplifying events, the question was directed to me. Of course, Maria had helped, and it was taken care of, but just would like to add a bit. As you know, the amplifying events are like what we said earlier. It could be stadiums or places of worship. And we have two countries that are good examples, especially with these two events, where the two events actually fueled the COVID epidemic. One is Korea, early days actually, and it was a church. As you know, Korea had the second largest number of cases in February after China, and the transmission was in a church, and the virus actually got the fuel from that crowded area, and they registered the second largest number of cases at that time. Of course, they moved quickly and suppressed the transmission. As you know, South Korea is one of the models now. And then the other event that everybody knows, the other amplifying event, happened in February again, around, I think, February 19 in Milano, when two teams played, and the full stadium was packed with 40,000 spectators. You know, the virus again in that stadium got the opportunity and you know, used that event to spread. So what we're basically saying is the best thing would be to avoid this kind of crowd and governments to do everything to avoid these amplifying events, so that the other economic sectors can actually open up and the economy can go back into life. I think we can live without going to the stadium. And we're doing that. Teams are playing in stadiums without spectators, but with live transmission, so people can see it from their homes. So if the risk is high, it's better to use that model without spectator stadium, teams playing. That's one model. And the second is in places of worship, what can be done is like what the Kingdom of Saudi Arabia did during the recent Hajj. A limited number of people, well-spaced, distancing, physical distancing, properly observed, with masks and other precautions. I think they have done the annual Hajj. So that's why we said it can be done, but with serious precautions, but the best would be to avoid it, especially if the risk is really high. Many countries went into lockdown because the virus was faster, because it used amplifying events like the examples I just said, and then the governments resorted into lockdown in order to be ahead of the virus. So to stay ahead of the virus, avoiding amplifying events or taking the maximum precautions when we want to do it will be very, very important. And as I said earlier, WHO wants the economy to open up. Lives and livelihoods cannot be separated, and we should do everything to open our economies, to open our schools. But since we know a lot about this virus now, we need to do everything to suppress transmission. Then on the demonstrations last weekend, I fully agree with Mike. We should listen to what people are asking, what people are saying. We should engage into an honest dialogue. And at the same time, though, to those who have demonstrated the past week, what I would like to say is the virus is real. It's dangerous. It moves fast and it kills. And we have to do everything to protect ourselves and protect others. I felt really sad. I'll just tell you a story that colleagues told me when they asked in one country about the high death rate, and some said, no, these are the elderly dying, so it's fine. No. When the elderly is dying, it's not fine. It's a moral bankruptcy. We should not be morally dead. Every life, whether it's young or old, is precious. And we have to do everything to save it. So the best approach would be something that works for all of us to stay alive, for the young, for the old. And that's why, even during demonstration or wherever when there are crowds, and especially amplifying events, we should keep our distance, we should wear masks, even if we may have a mild case, we should always remember that there may be another person who could be young or old who may have severe condition and could even die. But accepting someone to die because of age is moral bankruptcy at its highest. And we shouldn't allow our society to behave this way. We should care for one another. And there is a balancing act that can help us to protect our health and also to move ahead with our livelihoods. It's always possible to keep a balance. And that's why I'm stressing that it's always possible. Then finally, with the COVAX facility, I would like to use this opportunity to thank Germany. Germany has joined the COVAX facility today. And also we're negotiating with the rest of EU members. One possibility we're checking is for the EU members to join as a bloc. I think the best way to end this pandemic is through solidarity, through cooperation, through oneness. The best way to save lives and the best way also to move into faster economic recovery. Whether we like it or not, we're living in a globalized world, we're intertwined. The only option we have is to move together and to fight this enemy together. Thank you.
Thank you so much, Dr. Tedros, on those very moving words. I will now close this press conference and remind you that we will provide the audio file and Dr. Tedros's remarks right now, immediately after this press conference. You will also have the full transcript tomorrow. I apologize for those who could not get their questions answered. Please contact us via media inquiries and we will make